Hi everyone, good day and greetings. I hope you all are doing fine. This semester, I am taking Abpc 1103 Clinical Psychology, and my lecture for this semester is Madam Erna Nadira binti Kamalulil, and my metric number is 9708201257200001. My name is Jira Chandra Bungkias, and I am taking Bachelor in Psychology with honors in OUM Johor Bahru. In this presentation, I would like to present on ethics and professionalism in pediatric and clinical child psychology. For introduction, clinical psychology in children is a specialized field that focuses on mental, emotional, and behavioral well-being of children from birth to adolescence. Child psychologists are extensive training and experience in child development, assessment, and intervention. They work with children who are experiencing variety of challenges, including mental health, conditions such as anxiety, depression, ADHD, and autism. Behavioral problems such as aggression, tantrums, and defiance, learning difficulties such as dyslexia and dyscalculia, social and emotional difficulties such as shyness, social isolations, and bullying, trauma such as abuse, neglect, or loss. In clinical child psychology and pediatric, we must have our ethical practice, such as we must have our informed consent and assent. Obtaining informed consent from the parents or guardians and seeking assent or agreement from the child considering their age and understanding is crucial. Next, we must have our confidentiality and privacy. Maintaining the confidentiality or information except in mandatory reporting situations such as suspected abuse and protecting the children's privacy during assessment and interventions are essential. Next is competence. Only employing evidence based on practice and intervention within your expert and continuously seeking for professional development. Next is beneficence and no maleficence, striving to benefit the child and avoid causing harm, considering all potential risks and benefits of treatment and option. Next, respect for autonomy. Respecting the child's developing autonomy and decision-making abilities, involving them in discussion and treatment plans as appropriate for their age and understanding. Next is culturally sensitive practice, recognizing and respecting the child's cultural background, beliefs, and values while we are providing care for them. Lastly is fairness and justice, ensuring the equitable access to service and avoiding discrimination based on race, ethnicity, socio-economic status, or other factors. In pediatric and clinical child psychology, we also have our unethical practice, which is breaching the confidentiality, disclosing confidential information without consent except in legal mandated situation. Next is exploitation, taking advantage of the power dynamic between the professional and child, using the child for personal gain or participating in research without proper consent and safeguards. Next is practicing beyond competence, employing intervention beyond one's expertise, potentially causing harm to the children. Next, engaging in dual relationship, establishing personal and professional relationship with the child of their family beyond the therapeutic content, creating a conflict of interest. To avoid this unethical practice, we have our essential ethical principle, which is first, the best interest of the children. Always prioritize the child's well-being and act in their best interest. Next is ethical codes. Adhere to establish ethical codes of conduct within the field of psychology. Third, transparency and honesty. Communicate openly and honestly with the parents or guardians and their children, ensuring they understand procedures and have their questions addressed. And lastly, continuous reflection and self-evaluation. Regularly reflect on your practice and seek supervision to maintain the professional growth and ethical awareness. Ethical dilemma in pediatric and clinical psychology can have a profound negative impact on the psychological well-being of children, with consequences that can extend far into the future. Here's how. First, it breaches the trust and confidentiality and can cause loss of safety and security, fear and withdrawal, stigma, and also shame. Next is unethical treatment practices. Can cause psychological harm and trauma, exploitation, and manipulation, and also iatrogenic effects. Iatrogenic effects refer to the unintentional harm caused by health professionals. Unethical practices like inaccurate diagnosis and inappropriate treatment plans can lead into the delayed healing and create new anxieties and frustration to the children. Next is discriminatory practice and lack of culturally sensitive care can cause the children will feel unseen and unheard, internalize stigma, and also perpetuating systemic inequalities. Perpetuating systemic inequalities is an unethical practice that reinforces systemic inequalities and can create the cycle of disadvantage for children, limiting their opportunities for growth and development and also impacting their future life outcomes. Lastly is lasting consequences. These challenges can have lasting consequences for child psychological well-being, shaping their future help-seeking behavior, negative experience, or discourage children from seek help in the future, hindering timely intervention and potentially leading to a longer term of struggle. The unethical conduct within pediatric and clinical in child psychology is crucial. By prioritizing the best interest in the children, upholding ethical principles, and also ensuring the cultural sensitive care, professionals can create a safe and supportive environment to the children to heal and thrive, minimizing the risk of lasting and detrimental consequences for the psychological well-being. As I mentioned above, continuous education in ethics plays a crucial role in professional development for clinical and pediatric psychologists, contributing the overall well-being of children they serve. Do you know we can enhance our ethical knowledge in awareness, such as staying updated on codes and guidelines, regular engagement with the ethical codes and guidelines, ensure professionals are aware of the latest updates and adhere to involving standards and best practice. Next is understanding emerging issues. Continuous education can address emerging ethical challenges in this field, equipping professionals to handle complex scenarios involving technology, social media, and involving cultural contexts. Next is deepening knowledge of specific populations. Education specific to working with children, including with the unique development needs and vulnerabilities, help professionals make informed ethical decisions that prioritize in well-being. Other than that, we also can develop a critical thinking and decision-making skills through the case studies and also ethical dilemmas. Engaging with case studies or real-world ethical dilemmas through workshop and training allows professionals to practice applying ethical principles to complex situations, sharpening their critical thinking and decision-making skills. Next is reflective practice and self-evaluation. Continuous education fosters an environment to reflective practice and self-evaluations, encouraging professionals to critically examine their own bias and assumptions, leading to more ethical and also cultural competent care. Enhance more on this field, we have our promotion of professional communication and also advocacy. For effective communication skills, training in ethical communication helps professionals to navigate difficult conversations with children, parents, and guardians, ensuring clarity, transparency, and respect for the individual rights and values. For advocacy for children's rights, continuous education can equip professionals to advocate for children's rights within the healthcare and system-body society, promoting policies and practice that are safeguard and also their well-being. Professional bodies play a critical role in promoting ethical practices, such as developing and enforcing ethical codes. They are responsible for developing and enforcing ethical codes and set the clear expectation for professional conducts within the field. Next is they can provide educational resources, facilitating peer support and mentorship, and also discipline, action, and also monitoring. This role of professional bodies can be seen in nurses, surgeons, doctors, parents, psychologists, and many more. We have reached the end of our slides, and in conclusion for this presentation is continuous education in ethics is not just a requirement, but a vital component of professional development in clinical and pediatric psychology. By promoting ethical knowledge, critical thinking, and professional communication, this education empowers professionals to prioritize the well-being of children and ensure ethical and culturally competent practice in a continuously evolving field. Professionals' bodies play a critical role in supporting this effort, ensuring a safe and ethical environment for children seeking mental health service. We have reached the end of my presentation. I hope you all are enjoying and can gain something from my presentation. Once again, thank you for listening.